Hey everyone, thank you for joining us on August 9th. It's 9 p.m. and this is our virtual town hall, Living with Lupus and COVID-19 in our community. I'd like to thank all of you, first of all, for coming and spending some of your Sunday evenings with us. As always, I'd like to thank the Lupus Foundation of America, Georgia chapter, Terry Iman especially, for helping us to coordinate all of this. Representative Kim Schofield and Chris Reed and others in the Georgia Council on Lupus Education and Awareness, and Emory University and the GOLD Project. So we march on. We're nearly at 5 million, or I think we might have hit 5 million total infections just recently, even after this was pulled yesterday. But in any case, we will be in the lead for a while. But you can see the tremendous numbers in Brazil and India, and then the rest of the world you see there on the list. These are the hotspots from last week. And you can see the US, Central and South America in particular. And then you can see parts of Russia, Middle Asia, Middle East, and then Africa, especially South Africa. And it hasn't really changed tremendously this past week rather. Notable, I would say also, is that in terms of the burden in Africa, there's about almost half of the cases are in South Africa, actually. So there's a tremendous amount there. And then Australia is heated up a little bit as a whole country, but they are really taking this seriously. And if I had to throw a pop quiz out there, do you know where in the Western world can you go out only once a day at the present? I'll let you chew on that for a second. Where in the Western world can you go out only once a day? In metropolitan Melbourne, Australia, only one person per household is allowed to leave their homes once a day outside of curfew hours to pick up essential goods, and they must stay within 5 kilometers of their home. And this is backed up with a fine of around $3,500 US equivalent, and you can have repeat offenders fined up to over $14,000. So it just gives you a sense of how differently different parts of the world address it. Obviously, we have a very mixed bag in the US, and that certainly translates to the maps that we have seen. These are the hot spots from last week. Pretty heavy in the Southeast, and not much has really changed this week. And just to note that, again, the areas that were extremely hot before, we're talking the New York City area, parts of Seattle, those areas are not as raging. Always at risk, obviously, but with some coordinated effort, especially, I think we can make a difference. What you also should notice here too is, if you look across the Southeast, we're not talking only areas that are heavily populated, and we've been talking about, especially in the state of Georgia, the burden in the rural areas. But this is a concept that is really being brought to the forefront of the national awareness. And that is Deborah Birx, a part of the White House COVID task force. She's been on the news quite a bit. She really emphasized how this virus is really transcending borders and boundaries and class, and especially population now. And she calls this a new phase of the epidemic or the pandemic, urging people to really follow public health guidelines as cases continue to climb in many parts of the US, especially rural areas. And she's saying what we're seeing today is different from March and April, and it's extraordinarily widespread. And it really is into the rural as equal to the urban areas. And just to underscore that a bit more, 36 states account for 3/4 of the US population. But if you look at the hotspots in terms of where COVID is, it certainly hits some areas that are heavily populated, California, Florida, but you're talking a lot of other places that are not as heavily populated. Rhode Island, Nebraska, South Dakota, North Dakota, Montana. And so the point being that, this is really into the community in the truest sense, in the community in the cities and community in the rural areas. And it's unfortunate that we got to this point, but we have to recognize that it really is an entity that is going to go everywhere and anywhere. And we all have to be on guard and coordinated in our efforts. And certainly people, even in the highest office, are not at risk. You might have heard of this incident where the Ohio governor, who's a Republican, was supposed to meet President Trump, and as per the protocol, everybody gets a rapid screening test, and he was screened as positive. And subsequently, actually, after the meeting was canceled, there's a confirmatory test called the PCR test, and that actually was at least done once, I believe more than once, but it was basically negative. So he had what turned out to be a false positive test. And that can happen. These screening tests are not perfect, and that's why we have really good follow-up tests. I think this underscores the need to have screening tests, even though they may not be perfect. And the fact that you can have some false positives, again, is a risk that you have with certain types of tests. But it makes for a good screening test if that false positive rate is not too high. And it would catch people, especially those that are asymptomatic, like Governor DeWine. And that really would be one of the ultimate goals from the pandemic, is to be able to have rapid tests like the politicians have, like the professional athletes have, where we can go before work, before going to school, before being with our loved ones, have a result within an hour or two, and be fairly confident about it. And sure, there may be some false positives, and it can get some people nervous, but for the most part, it will capture people that otherwise would not have known that they were infected. And again, we have confirmatory tests are much better. So, maybe this will jar some of the politicians to really kind of focus back on testing that we all need access to. Because again, this mystery of who has it, who doesn't have it, with or without symptoms, it just really is the biggest Achilles heel right now. So last week, these are the reported cases total of positive COVID tests on a weekly basis. And you can see that even in the early pandemic, it only got to a certain level, and we're really at a whole new different level. But it's plateaued, and it's starting to come down on a national basis. And as we discussed earlier, the deaths early on were a result of older and higher risk individuals getting it, more so than the younger individuals now. But even so, with younger individuals getting a lot of the cases, the deaths will follow, unfortunately, even in the young, to a lesser degree, but still there, and spread through the young to other individuals at higher risk. So nationally, we are still seeing an increase as of last week. Good news is that this week, we continue to see not only flattening of total cases nationally, but it is starting to go down, and that's great. But again, look at where we are in relative terms to previously. We're not even close to being in a comfort zone, but the trend is good. And again, the deaths that really lag behind the cases a couple of weeks or so, generally speaking, we're starting to see a national decrease in the deaths. So again, we still need to be very cautious, but hopefully people are starting to really turn things around, even if the government isn't coordinated in efforts to help us to do so. This is last week in terms of the hotspots in Georgia. Excuse me. And it really hasn't changed terribly in terms of the hotspots for this past week in Georgia. Again, a lot of rural areas that continue to really flare up, especially in the north and the southeast and the south parts of the state. These are the counties ranked in terms of the total number of cases per 100,000. So really, when comparing apples to apples across all counties, whether big or small, how many per 100,000 are getting it? And you can see really high rates in some of these rural counties. And then in terms of looking in Georgia specifically of reported cases, you can see that, again, Georgia is extremely high relative to early in the pandemic, but you are starting to see a reflection of what's going on nationally, that the rates are starting to come down. The death rates are still very high, and it seems to be still rising, and so we'll have to keep an eye on that. But it's good news that I think the overall cases seem to be starting to come down. But again, put that into context, please. It's good that we all are doing our part and I think helping to mitigate the spread, but the spread is still very high. And so just be reminded of this red map. There's still a lot of cases throughout the state, even though relative to last week, things are starting to get better, but still not good. And what's still not good is this racial disparity that we're continuing to see. And there's a really high price in Georgia, as you would not be surprised to hear. But nationwide, Black people are dying at 2.5 times the rate of white people. And there's a lot of reasons for this. But in terms of better understanding those reasons, and more importantly, having ways to reduce that disparity, we need to do a much better job. And I really am focused on this as part of what we do in Lupus every day at Grady and Emory. So we'll certainly bring some news with regards to this as the weeks go on. Here, Georgia, this again is reporting about race and ethnicity from the COVID Tracking Project website. Again, to underscore what's happening in Georgia in terms of racial disparities. In Georgia, Black or African Americans are about 1/3 of the state, but they represent more than 1/3 of the cases and nearly 1/2 of the deaths. The Hispanic population in our state is only about 9%, but represents 20% of the cases. Fortunately, in Georgia, for some reason, the deaths aren't as reflective of this really high number. I'm not really sure the reasons for that yet, but that's good. It's still not a good thing to have 6%, but and then it doesn't mean that this 20% isn't without cost, as we've discussed in the past. So it's really these special groups that I think we need to focus on, keep them in our prayers, and especially as it relates to lupus. It's a condition that disproportionately afflicts minorities, and then you have the double whammy of potentially having COVID on top of that. So we need to be especially on guard for those that are from the minority communities within our families. The Georgia dashboard, if you will, from this COVID Act Now website, I've mentioned it in the past, gives you sort of a quick idea of different groups of numbers. And you can see kind of the color coding with respect to each group. We could still continue to have a dangerous number of new cases. Excuse me. The infection rate, though, has steadily been around 1, and it seems to be itching down just a bit. So that's good. And even though a lot of people continue to really have the infection, the rate at which it's spreading is going down or holding steady, and it's not at a very dangerous rate. So eventually these new daily cases should start or continue to come down. This represents the fact that we're still not to the point where we're testing enough. If we had the ability to test a lot of people, especially in some asymptomatic screening, to try to identify those people and get them out of the pool and interacting with others and infecting them without knowing it, this positive rate really should be around 5 to 10%. So we're still not where we should be in terms of testing. Thankfully, the ICUs, it used to be 99% used or utilized, but we are starting to come down a bit in that number. So we're still in the red area. So for those that are really sick, there is a danger, especially in some areas where there's very limited ICU capacity. But generally speaking, we're heading in the right direction in terms of bed availability in hospitals in general, but especially in the ICUs. And contact tracing, as I've also mentioned in the past, is a very challenging thing in general to do. We would love to have this higher, but it is what it is in terms of the 8%. This COVID Act Now website does do some modeling or projections with statistics and mathematics. And the black number line represents hospitalization over time. And you can see how it's steadily gone up recently. And this blue line here is what the projected trend based on current numbers and conditions. So it does continue to go up, but really not as high. And you can kind of imagine it heading towards stabilization, and presumably we can go down from there. But just to give you a sense, if all restrictions are lifted, that we would exceed bed capacity in our hospitals by September 7th. So again, just to underscore that these are always going to be smoldering embers of coals ready to ignite at any minute. And I've also used the analogy of whack-a-mole. And that's what's happened globally. Even countries that have done really well, they have little flare-ups here and there. And so for us, it may seem like we're getting much better, but again, we just need to continue to be mindful and get through together to make sure that we don't go back up in terms of some of these numbers. These are hospitalizations in the metro area. The bottom line here are those that are in the hospitals, in the ICUs, and then the top are in the hospitals but not in the ICUs. So both lines, I mean, they've gone up recently. The ICU bed utilization rate is really stabilized. The total hospitalization bed utilization is starting to come down. So this is another way to kind of represent everything rolled into one, that the hospitalizations are starting to stabilize across the metropolitan area. So Governor Kemp has signed 2 executive orders in the past couple of weeks that extending existing COVID-19 safety measures and this public health state of emergency. The safety measures are requiring that everyone in the state maintain social distancing, banning gatherings of more than 50 people unless there is 6 feet between each person, sheltering in place for those living on long-term care facilities and the medically fragile, and outlines mandatory criteria for businesses. And so this isn't really anything new, but in terms of an executive order, he's extended a lot of these things, which is good. But a lot of us in the medical community and other communities don't think that's gone far enough. And if you haven't seen this opinion letter that got published in the AJC, one of the local infectious disease doctors really worked on behalf of all of us to get signatures from over 2,000 healthcare workers and signed on to a letter that basically endorsed recommendations from the US task force with certain modifications, but we really emphasized that and to push the governor to temporarily anyway institute a statewide face covering requirement outside the home. We think that would really make a big difference. People are already making a difference to their credit, and that's what Governor Kemp has maintained that could happen, but we're not anywhere near where we should be. And so many of us feel that we need to have a mandated masking order for the entire state. And of course, going further down, you can see the other recommendations there. And really to make a statement about eliminating the racial and ethnic disparities in COVID-19 hospitalizations and deaths. Okay, so moving on into the questions. I have a relative who has myasthenia gravis. And for those of you who don't know, it's an autoimmune disorder that affects the way the nerves send signals to the muscle, and so people can become very weak. He has been working from home, but his employer told him and others to prepare to return to the office. How concerned should he be? So it's not different from lupus in the sense that the concepts are similar. We're talking about both conditions having some people on various degrees of immunosuppressive medications. And when you're on any immunosuppressive medicines, that increases the risk of potential infections, including COVID. So there's always going to be that increased risk, and not knowing exactly how severe that infection would be if one were to get it. And so without any other information, we continue to view everyone with an immunosuppressive condition like lupus and myasthenia gravis as a high-risk individual. So we want to be extra cautious. And the reality is that employers can mandate people returning to work. And it's something that we're going to have to adapt to as a community. But in the sense that we need to be armed with information as to how best to protect. And we've talked about over and over the things that need to be available for everyone with a high-risk condition like lupus and myasthenia gravis. Access to personal protective equipment, including masks, face shields, if within close distance to a lot of people, very close distance on a regular basis. We're wearing face shields and or goggles on top of masks in the hospitals based on CDC requirement. But ideally, that would be the case for individuals working in any field if you're more in direct contact. But if you can maintain at least several feet and not within several feet of people for a repeated period of times or a long period of times, you don't really need that face shield per se. But certainly masks, hand sanitizing equipment, general work accommodations as people may potentially have symptoms or actually even get sick. So the concern obviously is there, not unlike those of us with lupus, but I think we're all grappling with how best to live in this new world, and the reality that some of us must go back to work based on our individual circumstances. But I think you can do that with some confidence if you're able to have this equipment, have a relationship with an employer who is concerned enough to be able to really be on top of the recommendations and work with you to minimize your concerns and the risks. If two individuals have tested positive but live in different households, can they meet and share in the same household for a limited visit? Do they need to wear masks around each other? I think what you may be implying here is that they may be immune, because once you have an infection and you develop antibodies, you may be at either low risk or no risk of getting infected again. The reality is we still don't fully understand the immunity as it relates to COVID-19. We're still early enough in the pandemic where obviously people have gotten infected, but we don't have really solid information as to guide us as to how long immunity lasts in people who have developed COVID-19. And people do remain infectious for variable periods of time. it generally is no more than 2 weeks, but someone may become less infectious or not infectious earlier than that. Other people may still be infectious for a time after that. So you never know who exactly remains infectious, uh, how long their immunity will last, and even if there is immunity, there's always a concern that one of the individuals could still be a transmitter of virus to another individual. And even if that person were immune, could that person be um, a way for that virus to be transmitted to other people that that person eventually gets in contact with? So to be extra cautious, uh, I would definitely do the same cautious things that everybody else needs to do, and that's to wear masks, to maintain social distancing, and to sanitize. I wish I could give a better direction to that, but there, to my knowledge, there is no solid scientific evidence to be able to direct those individuals to do anything less than what everybody else is already or still doing, unfortunately. And that does seem to be a shame, isn't it? That they both paid the price, so to speak, to have gone through the journeys that they have, but not be able to reap the benefit of at least some period of time. And I'm not saying that they don't have that. We just don't know. And I think you're just taking a good risk if you don't practice the safety measures that everybody else should be doing until we learn more information about this. I work with underprivileged children, even with school closings. We will have our program to help these kids to adjust and keep up with their work. My question to you is, I have lupus and 3 other autoimmune disorders. They're fairly mild. I work one-on-one with kids, and I wear masks all the time and wash my hands. What else can I do to protect myself from getting sick? And first of all, thank you. Thank you for being a frontline provider for these families and for the children. I think even more so in some ways than the images of individuals in the emergency room and ICU, you are equally brave and needed, and we should really thank you and keep you in our prayers. So thank you for that. In terms of what else can you do to protect yourself, just know that you're in a high-risk area and you just need to be extra cautious. You know about the masking, you're cleaning your hands. You have to try to maximize social distancing between the kids and between the children and you, but I know it will be a challenge. You may want to consider a face mask on top of the mask. Some people are getting confused that if you just have a big plexiglass barrier that goes over your face, that's good enough. The aerosol can be around in the air. It can go underneath or over and around the barrier. But the barrier is good, and it's even better with a face mask still. So if you do the two, especially when you're closer to the children, I think that would be one more level. But just know that the transmission risk is what we're all worried about. And this shouldn't necessarily prevent you from doing your job, because I'm entering that area all the time. I'm going into wards and rooms where people have COVID. I mean, I know they have COVID. And there are wards in our hospital where we isolate people or concentrate those with COVID-19. And so there's a whole stretch of rooms where COVID's everywhere. And to date, I have not gotten it. And a lot of my colleagues have not either, because we're careful, we're aware. So I think that really is the key, is that the children that you're going to be around, you need to assume that there's going to be transmission between them. And if you know that, it shouldn't prevent you from working with them. It should just remind you on a daily basis that you just need to do these protective barriers to the best of your ability, and they work. We go to work all the time in the hospital. And yes, we have different equipment and things like that, but the basic principles are there. You still have similar equipment, the face masks, potentially the shields, the alcohol, hand sanitizers, the soap and water, the social distancing. Those are all the measures that we use. And to underscore the point about the children being transmitters, thankfully, again, most kids will be okay, but it's clear that children are very effective vehicles, if you will, for the virus to go from one individual to another. This is from the CDC scientific journal that I've mentioned a few times in the past called the MMWR. And this is regarding the camp that you might have, the sleepaway camp in Georgia that's been in the news where there was a coronavirus outbreak. And if you look at the people in the camp, and you can see the description here, there are about 597 total people. And there were multiple measures adopted by the camps to prevent the outbreak. They tried to do social distancing. They had a lot of hand sanitizing equipment around. They had people and children sanitized, although they did admit that the use of cloth masks was not universally implemented. But when you get a large group of kids or anybody in close quarters, and here they were sleeping in the same cabin and they were engaging in regular singing and cheering, which likely contributed to transmission, you're going to get that. And the numbers here to the right are, you can see the numbers of kids in the different age groups. So we're talking 100 between the ages of 6 and 10. Now the attack rate, I'm sorry, this is just a medical term. It sounds a bit worse than it is, but it's very simply out of the total number, how many got infected. And so you see between the ages of 6 and 10, the transmission in the environment that they were in, I mean, it's just so, I mean, this is just set up for COVID or and any other respiratory viral transmission. But these young kids were really effective transmitters. In fact, this was the highest percentage here, the age 6 to 10 group of people, of kids that eventually got infected. And you see the other age range groups were still relatively high, 44%, 33%, almost 30% here. So it really, I mean, it's part of these national stories that are out, and yeah, it doesn't really cause us to feel any better, right, as we start going into school season and as my kids are hoping to go back to school one day. And so we're hearing about these camps in the setting of schools, and it's going to be interesting to see. And we know about the Georgia schools in particular that are hitting the news a lot. And I think this school here is the one that has been closed or will be closed for 2 days because of a breakout shortly after this picture was taken. And I think that's really how it's going to be unless the schools implement much stricter controls. This is not a control. This is not a control. That camp was not a control. If you only do things part way, what's the point of having a bunch of hand sanitizers if you're in a cabin singing without masks on and spreading viruses throughout the air? Are there any studies showing that hydroxychloroquine works for COVID? If not, why are there so many doctors calling it a cure? There are no studies showing that hydroxychloroquine works for COVID. Just gonna let that sink. There are no studies that show hydroxychloroquine works for COVID. The doctors that are calling it a cure, they're quacks. It's made very confusing by the president. And I'm not trying to take political sides, but you just can't help but react to statements that are so blatantly false. And that's what's making everybody so confused, and it's adding fuel to the fire. When someone with a high visibility position keeps going back to making statements that have absolutely no basis. So forget about it for now. In fact, it's been shown to be harmful for the people who are really sick with COVID. The question of whether it may help reduce the chance of getting it is still not fully settled, I admit. But even the early observations and how we know it works doesn't give me any sense that it's something that I would do. And I promise you, I have easy access to hydroxychloroquine. I'm a rheumatologist. I can prescribe it for myself if I could, if I had to. I don't take it. My kids are not taking it as they go potentially back to some school activities. My mother, who has lupus, she's taking it, but for her lupus, not for COVID. So these are myths that we continue to have to deal with. And this is a really big part of why I'm so passionate about doing these Sunday talks, is so that we help learn and teach each other. We need to really speak about these myths and how they continue to go back into our communities only to hurt people and really knock them out together. I don't know if I did mention in a previous week about the WHO, which I know Trump has pulled us out, the US, from formally funding and being part of the World Health Organization, but they do some good work regardless, and they will continue to do so. They have busted a lot of myths, and they have a website that I'll reference again in a minute. But do you know which one of the following myths the WHO busted? It's all of them. So if you've ever heard anybody or wondered about some of these things, you may want to go check out their website. And here they talk about hydroxychloroquine, very straightforward statements, and really drills down to why they answer in that way. I mean, the fact here is studies show hydroxychloroquine does not have clinical benefits in treating COVID-19. And it has a very brief explanation of that, some background. And they go a variety of other things too, in addition to those other things that I had in a couple slides before, whether shoes spread COVID, bunch of other things. They have some videos with some of these answers, so check it out. Some of them were quite interesting and entertaining and informative. And you can download and share and forward to people who are struggling or wonder about some of those questions. Hold your breath, yes. We hear a lot of talk about the cytokine storm and damage done by the inflammation occurring during COVID. As treatments are developed to treat the cytokine storm, will any of them be helpful in treating inflammatory responses associated with lupus? Possibly. For those of you, just to quickly explain who don't know, the cytokine storm is, cytokines are signals that the one way that the immune cells send signals to each other. And that's normal. But what happens in some people with COVID is that the infection then leads to an overreaction of the immune system. And what is extremely dangerous and has a high risk of fatality is this cytokine storm. It's that overreaction to the point where the body is causing a lot of damage to itself. Not only really high fevers, but blood clots and leakage of fluid into lungs, And that ultimately leads to a lot of people's demise when they um, get a very bad reaction to a COVID infection. So the cytokine storm is an immune reaction to the infection. It's not necessarily the infection going crazy, but it's the infection starting this immune reaction that just keeps going and snowballs to this really bad event. And in some ways, there's some analogies to lupus there, where the immune system is obviously overreacting. To answer this question a slightly different way to begin with, there are some treatments for lupus that are being used for the cytokine storm, steroids being one of them. Dexamethasone is what they're using now, but it's basically prednisone at really high doses in an IV form. That's been shown that when you use it at a critical period of time when the cytokine storm is happening, we use prednisone despite some of the things that we don't like about it in lupus. We continue to use it to this day because it has such an effective dampening of the immune response. And so we use what we learned from lupus and other immune conditions for the benefit of the people that are undergoing the cytokine storm as part of this really bad response to a COVID infection. Now, there are other medications that are not being used in lupus that are being evaluated for not only the cytokine storm, but the infection itself, still related to the immune response. There's some very innovative biologic and immune therapies that are being developed right now. And many people think that these treatments, not cures, but treatments, will come online even before the vaccines, which will be great. Obviously, it'd be great to have something to prevent an infection to begin with, like a vaccine. But right now, it'd be great to just have some very effective and accessible treatments that for those who unfortunately were to get the infection, and even more unfortunately to have a really bad response. So yes, I mean, I think one silver lining out of all of this is that these are immune issues that will benefit not just COVID. We're learning a lot about the body, a lot about the immune system. We're developing at light speed technologies that allow us to modify the immune system, whether it be a vaccine or some of these treatments, as I mentioned. So one can only be hopeful that there will be applications beyond COVID, which I really don't doubt that there will be. And would lupus be a beneficiary? I mean, let's all keep that in our prayers. I think that would be a possibility for sure. Can a person develop a lifelong autoimmune disease as a result of COVID? We talked about in the past couple of weeks how there are ongoing symptoms even after the infection and people have become negative in terms of an active infection. So there seems to be a response to the infection, but once the infection is come and gone, that response remains. And some of these symptoms seem to be part of an ongoing immune response. Now, whether we call that a lifelong autoimmune disease, whether it's lifelong to begin with, we don't know. Again, we're just barely within 6 months or so of this. So we don't have a really good idea, but clearly there are consequences of the initial active infection that go beyond that period of time. Unfortunately, it's not most people, but that's the scary thing. You just don't know who this will happen to. There is a subset of people that continue to have very severe and significant symptoms that prevent them from going back to work. Really battling a lot of the things that they want to do, but just can't. And again, it's very similar to lupus, isn't it? Many of you have gone through active lupus flares. You go back and your doctors are telling you that your labs are fine, there's no evidence of disease activity, but yet you have this lifelong battle with fatigue and memory issues and loss and pain and depression. But you didn't have that before for the lupus. And so I think there are potential of lifelong, maybe not lifelong, but chronic or longer acting symptoms as a part of the COVID. And we're just learning more about it. And as a part of that, we are learning about the response in different groups of people, and children are very similar in many ways, but obviously they're different in many ways too. In lupus, by the way, children get lupus, they often tend to be more severe for reasons that we still don't fully understand. The way that their immune system is being developed, it just puts them at higher risk for certain things like kidney involvement or lupus nephritis. So it shouldn't be surprising that there will be some more severe, perhaps, or different immune consequences in people that are younger. And we're learning about in COVID, this multi-system inflammatory disease, which is very similar to that COVID cytokine storm that I just mentioned. It's not necessarily the infection that is going crazy. The virus is, the burden of the virus is going overboard, and there's so much virus that the body can't handle that. That's not what's happening in cytokine storm, and it's not what's happening in this multi-system inflammatory disease of children. It's actually the COVID virus kicks off the immune system in a susceptible person. And again, we don't know what makes someone susceptible more to this than another. But in some children, that immune system response goes overboard and creates this very severe inflammatory response. It looks very much like another condition that we deal with in rheumatology called Kawasaki's. It's a severe inflammation of lots of blood vessels. Thankfully, it doesn't take much for kids to, when they do get sick, and especially nowadays, the parents will get them to a hospital sooner rather than later. And then once they are in a situation with these severe symptoms, and this is now more recognized, we do have treatments for this. I'm not saying it's trivial by any means, but thankfully it's not as fatal as it could be. But it's a very severe disease if it's not treated, and it certainly could be fatal if it's not treated as well. But it's got some treatments for it, thankfully. So, speaking on the schools reopening face-to-face, the precautions are exactly what I was just mentioning for myasthenia and everything else. Other than the masks and social distancing, that's the precautions that are there. Remember, it's a respiratory disease. It's viral droplets that you want to avoid going from an infected person to you, and then to somebody else even. So what can you do to protect that virus going into that droplet and going into the air, especially, and into you and others? And so it comes down to masking all the individuals whenever it's appropriate. A face shield would be a barrier, again, for the viral droplets, at least going in that direction. The distancing, if some viral droplets do get in the air, the more distance you have, the greater chance it gets dispersed before it gets to you, or falls down due to gravity, or before it gets to you. And then the viral droplets that are on the ground or on surfaces, you clean them as much as possible. If you do touch an area that hadn't been cleaned yet, and you got the virus on your hands or other parts of the body, nothing's going to happen to you unless that virus from your hands gets into your respiratory system. So you wash your hands, you don't touch your face. And so as you go into this very uncertain period of time, just be reminded of the certainties that do exist. So I'm not going to get into the weeds of whether school should open or not. Those are questions that are at much higher pay grades, thankfully, than I have. But just know that if you have to be in a position, just go back to the basics. There's no secret sauce to this. There's no Plaquenil behind the scenes in your milkshake, or some special herb or drinking hand sanitizer or anything like that. And just practice these things and practice them well, and you'll be fine.